How do we investigate pelvic factor? First, we take a history. Do you have risk factors for pelvic factor? Did you have a prior pelvic infection? Did you have a sexually transmitted disease? Did you have pelvic inflammatory disease? That's when there's an infection all over your pelvis, and that can lead to damage of the pelvis. Appendicitis is not a pelvic infection in the same sense, but if you had an infection in your appendix and it burst and pus went everywhere, you had a pelvic infection from your appendix, and that could have caused pus in the pelvis and a blocked tube. If you had an IUD and had an infection while the IUD was in, you may have risk factors for pelvic problems. If you've had a prior tubal pregnancy, it means there's something wrong with your tubes. If not before you had the prior pregnancy, then after from having the pregnancy in your tube itself. So we need to check your tubes to make sure they're patent. We need to check your history to make sure you don't have these risk factors.